Testosterone replacement therapy can have significant effects on health and weight loss for overweight men with low testosterone levels. A case study from Russian endocrinologists examined the impact of long-acting testosterone injections on an obese 42-year-old man weighing over 150 kilograms. The patient initially presented with multiple health issues, including high cholesterol, high blood pressure, depression, fatigue, reduced libido, and impotence. He had previously attempted to lose weight without success and had given up on lifestyle changes. The researchers suspected his low testosterone levels, common in obese men, may have contributed to his depression and inability to make positive changes. Over 16 months, the man received regular injections of testosterone undecanoate. The treatment regimen involved 1,000 milligrams injections at weeks 0, 6, and 12, followed by injections every 12 weeks thereafter. Doctors monitored his PSA levels throughout treatment to assess prostate cancer risk. The patient experienced rapid improvements. He began exercising regularly, including swimming twice weekly and daily walks. He also adopted a healthier diet. These lifestyle changes, combined with the testosterone therapy, led to dramatic weight loss of 50 kilograms over the 16-month period. Beyond weight loss, the patient saw resolution of his metabolic syndrome and associated health issues. His cholesterol levels, blood pressure, and other metabolic markers improved significantly. The researchers noted the unexpectedly quick and successful recovery from metabolic syndrome. The case study suggests testosterone replacement may help break the cycle of obesity, low testosterone, and poor health in some overweight men. By improving mood and energy levels, the therapy may enable patients to make necessary lifestyle changes. However, as a single case report, broader conclusions cannot be drawn about the exact mechanisms involved. Testosterone therapy requires careful medical supervision and monitoring. Potential risks and benefits must be weighed for each individual patient. Regular blood tests are needed to check testosterone, PSA, and other health markers throughout treatment. Diet and exercise remain crucial components of any weight loss plan, even with hormone therapy. This case demonstrates the potential for testosterone replacement to jumpstart weight loss and health improvements in obese men with low testosterone. However, larger controlled studies are needed to fully understand the effects and determine which patients may benefit most from this approach to treating obesity and metabolic issues.